Hi, I'm Mel Pickup, Chief Executive of Bradford Teaching Hospitals, and welcome to this week's update, which focuses on our people. Today, we hear from Professor Dinesh Saralaya, Respiratory Consultant and Associate Director for Research, as he reflects on the third anniversary of the COVID-19 outbreak. We also hear from Ruqayya Mir, Deputy Associate Director of Nursing, about her role in combating vaccine hesitancy across the district.
The first signs of the pandemic was going to come to us came around the 10th of March. They started planning that if it comes to Bradford, what we're going to do. On the 16th of March, they opened a ward. Bradford is a bustling city. People are out and about. There's a large young community which is in the service sector. But on the 23rd of March, this city was completely shut down. We didn't know what the treatments were. We didn't have a vaccine. From one patient on March 16th, we quickly became 100. And then that number rose to close to 200 patients by June. When we were seeing the first patients with COVID-19, we didn't know how to treat them. We were treating them from the lessons we were learning from China, from Italy, talking to colleagues, and we're treating them as patients with a severe viral illness. In Bradford, we made a very early decision that in April, we started taking part in the various COVID treatment trials. The biggest trial was called the Recovery Trial, which was run from the Oxford. And then when the vaccine trials rolled out, we were able to take part in 3 landmark vaccine trials over 2 years to help the world understand what is the vaccine needed for COVID-19 and how many doses we need. I've been practicing respiratory medicine for 20 years, and it was the most challenging part of my entire career. The support that we had at Bradford Teaching Hospitals to run the trials, to find an effective cure, as well as develop vaccines was stupendous. In fact, the highlight of my research career was to run the Novavax trial. I've never recruited 726 participants in a trial, but to coordinate it required a huge team effort. And thanks to the hospital, the Bradford Institute for Health Research, the Patient Recruitment Center, we were able to run that trial. It was a huge amount of work, but it was extremely gratifying.
It was a very scary and a very worrying time, predominantly around patient care and how we maintain safety. I was one of the first to have lost one of my staff, which really affected me in our organisation. But to see the loss of patients and see the national data that saw disproportionate deaths amongst communities regardless. It was a very frightening time. As a clinician and as a leader, your focus is on stabilising your services, caring for your patients and your teams. I moved into the vaccine equalities role, and this was about rolling out the vaccine to all our communities across Bradford District and Craven. I didn't know what I was going into, but I did know that I had every energy and motivation to increase vaccine uptake, encourage anyone that had doubts, questions and needed support, because it was a time for call to arms and it was working in partnership. There were themes and concerns coming out which I needed to listen firstly and find realistic support mechanisms to reassure people and have answers to their questions. Some communities, such as South Asian communities, were frightened of infertility as a consequence of taking the vaccine. Amongst some Eastern European communities, there were fears of going into vaccination centres. The task was huge, but so was the support and the alliance and the allegiance, because it became a mission that we all had vested interest. It was a common purpose and a goal. And it created one of the most greatest, profound partnership working, the likes of which has never been seen in the NHS, and one which I wouldn't have experienced in my lifetime.
COVID-19 is still circulating amongst us. It's not gone away, and it's probably going to be here for many years to come. But fortunately, we have a very highly vaccinated population in Bradford and in the country. And we also have what is called innate immunity and herd immunity. So people have had COVID-19 before. So thankfully, the illness is only incidental at the moment, and most people who have COVID-19 have got a mild illness. They're not coming so much into hospital, and those who are hospitalized are getting better quickly with the treatments that we have. So we're in a much better place than what we were 3 years ago.